Hi, welcome to You Can Do Medicine. My name's Tom. I'm a first year medical student at Edinburgh University. And today we're really lucky to have Giovanni with us.
Hi.
And Giovanni is going to tell us his story of how he got into medical school.
Hi everyone, my name is Giovanni and I'm a first year graduate entry medical student. I recently graduated in neuroscience at University College London. I'm originally from Italy, but I moved in the UK nearly 6 years ago now to do what is supposed to be my year abroad from Italy, where I was studying at a scientific high school. I decided to study medicine quite early in my career, if we can call it like that. And that's because when I was 14, I started volunteering in a care home back in Italy when I started my scientific high school because we had to do some voluntary work for our school. So that's when I decided to join a care home a couple of days a week for 3 months and be in contact with patients and being around nurses and doctors and healthcare workers, that's when I started realizing that maybe the world of healthcare might have been one of the pathways that would actually interest me. So when I moved to England, I joined a sixth form and I studied for the IB rather than for the classical A levels that England offers. And that's when I was already kind of sure that I wanted to apply for medicine. So that's why I chose more scientific subjects. So basically, I did my IB hires in biology, chemistry, maths, and English B, and my standard subjects being Italian A first language and psychology. While I was in Cambridge, I actually volunteered at Edinburgh's Hospital for 5 months, and that's when I applied for the first time and didn't get in. I got a couple of interviews, went to the interviews, but they didn't get an offer. So I was kind of confused of what to do and what not to do. So I decided I was gonna choose something. I didn't want to stop my studies or take a gap year because I knew that if I was gonna stop, I was never gonna start again, or that was my fear at least. So I decided I was going to apply for something that actually interested me. So I didn't go for biomed science because I thought it was too generic. And because I was actually so into psychology as well as the sciences, the natural sciences, that's why the course in neuroscience actually interests me. I applied for it and I got an offer. So I actually studied there for 3 years at University College London. And that's when I started evaluating whether I was more suited for a more academic, scientific career or a more medical clinical career. Over the course of the 3 years, because of the pandemic, most of the university was actually online. So I went back to Italy for a while, where I actually worked as a healthcare worker in a care home for a year. And that's when I actually realized for sure that even if I didn't get in the first time, I would have applied the second time. I worked as a care home for a year, as I said, and being around patients in a challenging moment like the pandemic was, I think, key for me to realize that I would have preferred having a career where I would actually being around patients and talk to them every day and explore their feelings rather than being on a career where I would still help the scientific community and thus help people getting better, but I would not get any feedback from them because it would be much more distant in terms of a job because I would be in a lab rather than in a hospital being in contact with people. So that what made me actually apply again for medicine. So I applied again and I got in. But one thing that I realized that during the course of the time is that although I wanted to be a doctor, I would not want to stop being an academic because during the summer before joining medical school, I spent my summer in a lab continuing what was supposed to be my dissertation, that it was about pain. So we basically investigated pain in adults and whether there were detectable methods and biomarkers that could be detected in the brain that could basically help identify that like the amount of pain that a person would perceive. And that's what made me realize that I just basically enjoy the both of best, like the best both worlds. And so at the moment, I'm actually still interested into research, and I continued doing research over the summer. And that's, well, basically, I've got an idea for my future. Like, if I had to think about my future right now, I would definitely apply for an academic foundation year program because I realized that I want to be both an academic and a doctor. So maybe pursue a PhD, and who knows. But I'm quite grateful that I did a degree in a science before joining medicine because I feel like it's giving me the basics to actually approach university in a different way. Like, I now I've got my techniques to learn, I've got my methods for making my notes, so I can kind of get an idea of how to face the course, which I'm finding much more challenging than the neuroscience, because although the learning is the same, it's much more packed and there is many more things to do. So the fact that I already got a degree, I know how to approach university life, I know how to manage my time. So I, when before getting into medicine, I thought that it was just a waste of time of having a degree that I would never use. It actually made me realize that I want to be an academic, that I want to be a doctor because it confirmed my interest for medicine, and plus improve my time management skills and my learning abilities. So I'm quite happy about the career that I've been going so far, and hopefully I can pursue what is going to be the life of an academic doctor. So thank you.